Ayurveda is not against surgery, or it gives much importance to surgery actually. There is a main branch in Ayurveda which deals with the surgical procedures, and many of the diseases are prescribed to be cured, to be practiced by surgical methods. There are descriptions about different types of surgical procedures and surgical instruments, etc. There was a period where all the Ayurvedic practitioners were practicing surgical procedures. And what happened? Then later there was some declining period for that. It doesn't mean that Ayurveda is against surgery. There are a common belief that Ayurveda is a science which is not giving importance to surgery. It is not like that. Actually, and I think now everybody knows the name Acharya Susruta. He is believed to be not believed. He was the founder or the first person who practicing surgery in medical field. He was an Ayurvedic expert, Ayurvedic Acharya, we will say. Even now in the very renowned medical colleges in allopathy have the statue of Susruta as the founder. But here in our country now it is not, now it is again started to improve the field of surgery in Ayurveda in academic level, and the subjects are very well, topics are, and this syllabus is renewed and modified accordingly, and some branches are highly giving much importance to the surgical methods. In the field of eye disease, there are so many surgical procedures described in Ayurvedic texts, old texts, and there were people who are practicing it. For example, this cataract surgery, which is very common nowadays, and sometimes bread and butter in allopathic ophthalmology, it was very well practiced in olden age by Ayurvedic these Netra Chikitsa persons, those who are handling eye diseases. Like that, so many diseases are there where surgical procedures were practiced. And so, actually, I am not practicing surgery because I am not well trained in that. That is, in my educational time, in my student period, it was not much training was not given. Only with little training was there, and it was in allopathy hospital, the eye hospital of Government Hospital, but not that much experience. That was why I am not handling. So I selected medicinal field, that's all. And there are so many Ayurveda doctors who are handling these surgeries in northern states. They are successfully handling that. So Ayurveda is always respecting surgery, and about, I think, about more than 50% of disease of this Shalakya, the Shalakya means disease of ear, nose, throat, like that, and more than 60% of disease are to be treated by surgical procedures according to Ayurvedic science, Ayurvedic theory. There are people who are handling it successfully. I am not handling because I am more interested in medicinal approach. And also since I am not trained that much in that field, that's all.